Hi, you're listening to It Happened to Me, a rare disease and medical challenges podcast. The mission of our podcast is to support you, our listeners, and to create community as you confront the toughest challenges in life. All of us will experience health hardships. The real question is how we adapt. That's the focus of It Happened to Me, which wants to help you overcome limitations and live a full and satisfying life. Drawing on their own health challenges, co-hosts Kathy Gildenhorn and Beth Glassman interview guests who share stories and research to help you succeed in the face of difficult health obstacles. It happened to me. I'm not alone, and neither are you. Hi, this is Kira Deneen, the executive producer of It Happened to Me. I wanted to pop on to help frame this episode for you. This is the second half of our conversation with Dr. David Traster, a clinical neurologist and educator who has spent nearly 2 decades working with patients experiencing complex neurological conditions. Dr. Traster has advanced training in concussion, dizziness and vertigo, movement disorders, autonomic nervous system conditions, and childhood developmental disorders. His work focuses on helping patients improve function through neurorehabilitation and targeted exercises without relying solely on drugs or surgery. Last episode, that's episode 84, Dr. Traster introduced us to clinical neurology and explained how it differs from the traditional view of neurology. He also shared his own experience with chronic illness and a delayed Lyme disease diagnosis, and how that journey shaped his empathy for patients whose symptoms are misunderstood or entirely dismissed. We also explored concussion recovery, targeted brain rehabilitation, and neuroplasticity, the brain's ability to change and adapt through repeated activity. In this episode, we continue the conversation by looking at how the nervous system affects far more than movement, including pain, heart rate, fatigue, balance, vision, and everyday functioning. We'll also talk about patient advocacy, neurological symptoms that do not always appear on imaging or lab work, and what gives Dr. Traster hope for the future of brain recovery. I hope you learn as much as I did in these episodes.
How does the nervous system affect more than just movement? Things like pain, digestion, heart rate, or fatigue.
Absolutely. So the way a brain cell fires is the same no matter where it is, right? You have the brain cell and it's an electric organ or electric cell, and then it has a threshold. And when it gets the electricity to a certain level, it fires, right? So it's
Okay.
almost like having a dimmer on your light,
Right.
but instead of it slowly getting lighter and lighter and lighter to get the top, it's almost like you go up, 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 but it doesn't get lighter to hit the top, then just turns on. So it's almost like a dimmer, but the dimmer doesn't work. It only works when it hits the top.
It only works on and off.
Correct.
Yeah.
And so brain cells inherently are on and off.
Okay.
So when you look at what a brain cell does, it controls things. And so it will control your movement the same way it'll control your emotions, the same way it'll control your heart or your digestion. It's just different areas of the brain that have different jobs.
So I got to ask, will learning help those areas of the brain?
Sometimes you have to be more specific, but learning really stimulates the front part of our brain. And the front part of our brain is the thing that makes us the most human.
Okay.
And the front part of the brain kind of comes down and controls everything. Right? And so if you have to pick one thing to get better, it would be your learning cognition, because it's going to control your movement better, your emotions better, your autonomic nervous system better.
Okay.
And so having said that, though, some people, that's not the problem they have. They've got problems lower down in their brain. And so sometimes just learning more isn't going to fix their problem.
I see.
But it's going to help them from getting worse.
Okay.
Right.
As we age, we sure want to hold on to all those brain cells, doctor. I am fighting to hold on.
Me too. Me too.
100%.
So this is all very powerful and important information for all of us to keep that frontal area active, right? Even though I guess the brain is a big space. So there are plenty of areas that need stimulation, but we must keep activating our brain and learning, constantly seeking out new and interesting things to keep us occupied.
And part of that is also social interaction. I think
Social
during COVID,
interaction.
one of the negatives of COVID, obviously there's things that are more negative. But the isolation was really bad for people and their brains.
Yeah.
Right.
Yeah.
And even if it might have been necessary, a lot of people do poorly when they isolate themselves because, again, they avoid new things, they avoid new conversations, new people, new environments. And so when you look at modifiable risks of dementia, one of them is social isolation.
Yeah.
Huh.
Yeah. So sometimes even when you don't want to go out and go to a party, it's really good for your brain to do so. And
Correct.
get there, go and be social with your friends or meet new people. That's a stimulation for the brain. I wondered if there are neurological symptoms or conditions that don't show up on imaging or lab results.
All the time, all the time. When you look at MRIs or CTs, which
Yes.
are groundbreaking technology in healthcare, they're great at picking up strokes or tumors or maybe even like multiple sclerosis, like plaquing. But when you look at functional conditions, they're not going to really pick up a lot of these conditions. And a lot of conditions, whether it's depression, whether it's anxiety, whether it's concussions, whether it's a movement disorder, whether it's a migraine, a
Hmm.
lot of these conditions won't have the amount of injury that you might see in a CT and MRI. A lot of these conditions aren't going to have any blood work that's abnormal. And so when you
Mm,
look at all of our brains, we are who we are based on the connections of our brain, based on the way we develop, based on our genetics, based on what we do every day in our life. Those create connections in our brain, which represent our personality, our behavior, our thoughts, our movements, our interests. And when those connections become altered, whether it's because of metabolic conditions, genetic conditions, traumatic conditions, whether it's physical trauma or emotional trauma, they get altered, these connections. And when your connections get altered, your behavior gets altered. And so you're seeing more and
Huh.
more people rely on things called like QEEG brain maps, SPEC scans, functional MRIs, FNIRS. You're seeing more functional scans being used to try to
I
understand
see.
the function of people's brains. But again, one of the challenges is we don't have a baseline for that. And so when
Right.
you do a functional scan, one of the challenges in research and in practicality is you don't
What
know
is your normal? We
yeah,
don't know
what is
Yeah.
where
your
you
normal?
started. Where
Exactly, and
did
then
you
it's
start?
functional, so
Yes.
it becomes a little bit tricky to try to objectify it, but you're seeing a growing research and growing clinical value in these functional brain scans to try to understand over and under activity of the brain and blood flow.
Wow.
Hmm. Now, doctor, you talked about you spent years trying to find the diagnosis for yourself.
Yep.
Right.
So you are the perfect person to ask for someone who is living with neurological symptoms and they're not being taken seriously. How how would you suggest they advocate for themselves? What should they do?
That's a great question. Number 1, you have to be your own advocate,
Uh-huh.
and so you gotta really have some type of intuition that something's wrong if you think something's
Something is
wrong,
wrong.
and you can't really let people downplay that, it's less than it is if you really are having problems. Number 2, there pros and cons. When I was sick, there wasn't social media at the time, really. You didn't have
Uh,
as much information out there. You didn't have AI for sure. And
Right.
so, there's less ability to learn alternatives to what your medical doctor told you. And then today it's almost the opposite. It's almost too much information
Huh.
where you can almost learn too much that may or may not relate to you. And so I think what's happening now is you're going to have a better chance of finding the right practitioner for you that might do things a little differently. But even if you find the right doctor, it's a mutual agreement where you've got to find someone who can make the right diagnosis. And at the same time, you've got to have some ownership over trying to get better.
Right. Right.
Right. And so I think that number one is getting the right diagnosis, and that's hard to do.
yeah.
One of the
Very
things
hard.
really hard. That's one of the things we
Yes.
try our best to do.
Yep.
We always offer people honesty
Yep.
and a great evaluation. We don't
Hmm.
know if we can help anyone or we don't know if we get someone better sometimes. What we do know is we can be honest with people and we do a really good evaluation of their nervous system.
Right.
We try to understand what's going on with them. We do blood work, we do other scans to try to figure out what's going on with people because you can't really treat anything well if you don't have the right diagnosis.
Right.
Exactly. Exactly. And you certainly are an example of that.
Right.
How long you struggled.
Yeah, and
Yep.
that's where if anything I do well, I'm pretty empathetic with my patients.
I would
Uh,
imagine.
'Cause I've
Yeah.
lived it and I wish I could help
Sure.
people more than I can. But sometimes the best thing I can do, to your point, is giving them the right diagnosis and giving them in front of the right doctor, and that may or may not be me.
Hmm.
Right.
Wow.
That's just an amazing conversation we're having here. I've got to switch gears a little and ask, how do balance, vision, and the inner ear connect to brain health and everyday functioning?
For sure. When you look at balance, your eyes, your vision, your inner ear, You
Mhm.
could think of them all involved with spatial orientation. So one
Okay.
of the main things your brain does for you in any animal is where is your body in space and where is space around your body,
Okay.
right? And that's one of the most fundamental things we know about the brain for as long as we've known about the brain, whether you're a tadpole, a lizard, a bird, a human, a monkey. What you really need to know is you've got to move around your environment. And there's certain fish that attach to like algae and they never move ever again. And they eat their own nervous system for food.
Oh God.
Ooh.
So we know the nervous system
Oh,
primarily has to do with movement around our environment.
Mhm.
And then everything else is a little bit icing on the cake. So when you think about how do you move around your environment, the first thing is vision gives you the environment around your body. So
Mhm.
it's not that you can't move with your eyes closed, but you're going to move slower, more careful, and you can run into a wall, right? And
right.
so you've
Mhm.
got to trip over a stick. And so the first thing to do is understand how vision relates to movement. But then you got to know where your body is in space. So if you close your eyes, you need to know where your foot is, where your hands are, where your head is. And so you're going to have to know where your body is in space. And then thirdly, your inner ear is like accelerometer, decelerometers of your head. And it's going to tell you the speed of your head movement. And I always tell people it's like a game of telephone. Your eyes and vision should say apple, neck and body and feet should say apple, and your inner ear vestibular system should say apple. And when they all say apple, you feel balanced and you feel stable. If one of those systems says banana, that's
Mhm.
called a sensory mismatch, and that's what causes dizziness.
Yeah.
So if one of your inner ears gets dysfunctional, that's going to create an error in your spatial orientation, and that can cause dizziness. If you get
Huh.
a whiplash injury and your neck gets injured,
Yeah.
that can create a error in the system for spatial orientation that can cause dizziness. If
Mm.
you've got visual dysfunction, that can cause an error. And then if you have two of them, if you have an inner ear disorder and a neck injury, that gives you
Oh
more
boy.
problems. Right. And so the idea is now, how do you recalibrate the brain to
Uh-huh.
create better spatial orientation by doing therapies for your inner ear, your body, and your vision? So they're all saying the same conversation. Because when those don't happen, you can get motion sensitivity, you can get vertigo, you get imbalance. And so you want to feel your feet. So if you have a neuropathy, you can't
Mm.
feel your feet. That's enough to cause imbalance.
Mm.
Okay.
But your vision could take over and keep you balanced until you close your eyes and you're really off balance.
Right.
Right.
Now, what about people that have visual limitations or disabilities or say can't see? Are there brain therapies or brain vision related movements that can be helpful?
For sure. Number one, you want to make sure your body stays strong and you want to stay healthy, right? Because you're going to
Yeah.
want to rely on
Right.
these other systems.
Yeah.
You want to make sure your vestibular system doing specific eye head movements stays strong and healthy. And then when you look at vision, there's different types of vision. So there's like clear vision, which kind of is regulated by one part of the brain. Can I see you on the computer? But then there's other parts a little more primitive that's like motion detection, right? So some people have certain types of blindness where they can't see, but they can pick up motion. And so then there's training to identify motion better to try to make sure that you're a little more stable. But the reality is, if one system, whether it's a neuropathy for your feet, whether it's a visual disorder for your eyes, the first thing you want to do is you want to make sure all their friends are healthy. You really want to make sure you don't develop a neuropathy. You want to eat healthy. You
Yeah.
want to do exercise. So you want to really strengthen the healthy areas so you can rely on compensation. And then you could do eye exercises and other visual training just to try to keep your eyes as sharp as they can be with everyone has a limitation.
Huh.
You know, doctor, I have to tell you, we are discussing the most complex organ of the body, and that's your brain. And the examples that you're using, sir, I have to tell you, are so crystal clear.
Mhm.
You are making something that is extraordinarily complex. I'm even following you. This is a miracle, doctor. Your patients are really so lucky because you have reduced it down to an apple and I got it. We all have to be apple, and if I've got a banana, I'm in trouble. I mean, you really this is the brain is so incredibly complex. Your patients are very lucky, and I am so thrilled you're on today. I have to say, I really am. You are making something understandable that is incredibly complex.
The only way to actually
Incredibly.
treat people, right? The only way you can actually treat people
Yes.
is you've got to
Right.
make it so it's realistic.
So it's yes, so that we can understand, that the lay people can understand what you're saying. This is just I
This
am
is
so
amazing.
pleased. I really am. I am just amazed.
We
At
can't
the,
thank you enough. This
yeah,
is just extraordinary. And I know you
because
work with both young people and older adults. And how does neurological recovery differ across lifespan?
You're never too
mm,
old to make your brain better, right?
uh,
And so you're never too old to improve your brain, improve your function. But
Hmm.
no doubt, the younger you are, the more to your benefit.
Okay.
And the reality is, when you look at conditions like neurodegenerative conditions that end up having people in their 50s, 60s, and 70s,
Yeah, that's
a
me.
lot of those are progression over decades, right? So if
Uh-huh.
yeah,
someone has Parkinson's, the average Parkinson's patient, that could be a 30-year progression,
yeah,
Right.
right?
yeah,
And so the key is the more healthy and active
Delaying
you are
it.
younger.
Yeah.
I'm 42. I'm turning 43 soon. I have two kids, and I do everything I can to be healthy in my 40s, not just for my 40s, but
yes,
for my 70s and 80s.
right,
Exactly.
Because that's when I think realistically now we know more, realizing that it's the decades before you get older that really affect how you age. And you're
yep.
seeing much more people with anti-aging trying to get into it earlier or trying to
Mhm.
make up for lost time because they
Makes
didn't know.
so much sense. It makes this is more personal than we need, but my neuromuscular neurologist
Mhm.
told me that I have delayed some of the progression of my condition because of my exercise and food routine over since I was born.
100%.
And you're just making it so how the connection works.
Correct. And
Yes,
that's why we talk about genetic conditions. Sometimes, at some point with CRISPR and other things, the hope is we can
yep.
cure genetic conditions.
Right.
But sometimes it's not about curing a condition. It's about how do you make someone more functional and how they can
Mhm.
live a more functional life with the condition they have.
Right,
Exactly. And you got
right.
to play with the cards you're dealt, but you got to have the best strategies for living the best life you can.
And it's more impactful than
Yes,
people think. I think
yes,
historically, we said you have a genetic condition, deal with it. And I think
right.
we're learning more and more all the strategies you can do to live a better life with it.
Yeah.
That's exactly, and that's the whole goal.
That's
Because
what we do,
that's
what
we
we
do.
do. That's it
Yes,
happened to me. That's
yes.
exactly what it's
Yes,
all
that's
about.
exactly because we all will have something. We've got to learn to live with it. But movement is what you're talking, stay healthy, keep moving, don't be sedentary, don't isolate. All these lessons that we've learned, we need to take to heart and practice. I wonder, Doctor, what does repetition or targeted exercise, how does that play in improving our nervous system?
When you look at neuroplasticity, repetition is one of the foundational aspects of it,
I
right? And
see.
it's about doing the same thing over and over again. I had a basketball coach. He used to always say, practice doesn't make perfect, it makes permanent, right? And
Uh-huh.
if you practice in a bad way, you're going to be a bad shooter. Right,
Huh.
and so
Uh-huh.
the more you practice something, the more permanent it's gonna be in the connections in your brain. And so repetition is the way to create neuroplasticity. People fly to our clinic for usually I have people locally, but I have people that fly around the world, and they might come only for a week.
Where are
They'll
you
see them 3
based?
times. I'm based in Boca Raton, Florida,
Ah,
and so they might come 3 times a day. I might see them 3 hours a day for a week, and I'll tell them, "Even if your symptoms drastically improve, this program is a 3 to 6 month program."
right.
Right?
Uh,
You can practice something, get better in a week, but if you stop doing it for 6 months, you're gonna lose it,
Hmm.
right? So it's kind of use it or lose it kind of paradigm. And so our program, even our week-long programs, are really a 3 to 6 month at home program. And if
mm,
people are local, they're lucky because they can go further with us in our clinic. The more you practice something, the more those pathways in the brain get stronger until eventually we say functional improvements precede structural improvements. So as you start functionally improving and you continue to do it, you'll then create structural connections that'll make it more permanent.
So I'm sure that as a basketball player, you just shot hoops over and over again. I was a tennis player and I used to hit against the backboard for hours. I would just hit against the backboard. So that repetition is what is going to help you.
That's when I
Uh,
got good. I played basketball my whole life. When I got
yep.
good is when I was maybe 15. I went to a basketball camp and I saw some of the top players play.
Uh
And
huh.
I realized some of the best players in the world, it's not because they're genetically gifted or they're from a certain city. They were up at 6 a.m. and they were practicing all day.
Uh huh.
And that's when
Wow.
I started getting good at basketball when I was 16, 17. Although I was always above average,
Hmm.
I started really getting better when I realized I've got to practice 4 to 6 hours a day if I really
Wow.
want to achieve a certain level. and it became that, an hour of dribbling, an hour of shooting, 2 hour,
Uh-huh.
it became very specific drills over and over again every single day, hours a day before I realized that this is how you've got to make your brain better.
From your experience, Dr. Traster, what misconceptions do people have about the brain's ability to heal?
I think one of the big misconceptions, number one, is they're too old to get better. Number two, they're too sick or broken to get better.
Hmm.
And I think the reality is we could always improve our brain. And so I think when it comes down to brain health and wellness, the brain is changing every single day. 2 weeks from now, the connections in your brain are gonna be different than they are today. And so it's what can we do repetitively every day to make our brain healthier
Right.
in a functional way so we can be a healthier individual?
So, doctor, finally, what gives you the most hope when you think about the future of neurological recovery?
Technology. Honestly, I think
Ah,
technology is going to get so advanced that we're going to understand the brain better than we ever have. Right. And so
Hmm.
the brain is in some ways like a quantum computer, maybe more complex. We've got more connections in the brain than stars in the universe as we think. You've got about 80 something billion brain cells, and you've got amazingly amount more connections in the brain. So I think as there is better technology with AI, with scans, with computer chips, with all these nanotechnology, I think as technology gets better, we'll understand the brain better and we'll be able to interact the brain better because the brain is an electric organ. And I actually think it's more conducive to technology than drugs. Right. And so that's where I'm most hopeful is I don't know if it's gonna be next year, next decade, 100 years, but I do know that as we get better with technology, there's a huge emphasis on the brain and neurological conditions. So I really feel like we're on the cutting edge and the verge of kind of breaking through the brain and brain conditions. And I
Hmm.
think that technological advances are going to make all of our lives better in that aspect.
doctor, I only hope that you're right. And I want to thank you so much for being a guest today on It Happened to Me. You've unmasked the most complicated conversations and made it easy for us to understand. I'm so grateful to you and thank you so much for being with us.
Awesome. Thank you so much.
Thank you, Dr. Traster.
Awesome. Well, thank you guys so much. I appreciate it.
Thank you for listening to this episode of It Happened to Me. We encourage you to learn more at ithappenedtomepod.com. Please use the contact form on our website to submit your guest suggestions, comments, questions, ideas, and feedback for the show. You can also email us directly at ithappenedtomepod@gmail.com. We would really appreciate it if you can leave us a 5-star rating and review on your podcast app like Apple or Spotify. This helps others in the rare disease and medical challenge community find us. It Happened to Me is created and hosted by Kathy Gillenhorn and Beth Glassman. I'm Keir Deneen from DNA Today, and I serve as our executive producer and marketing lead. Amanda Andrioli is our associate producer. Ashlyn Anokian is our graphic designer. And remember, it happened to me. I'm not alone, and neither are you.